Hello everyone, I'm Dr. Tejashri and today I am going to decode the miscarriage profile. I will try to make it as easy as I can and like I explained to the patients who visit in my clinic. So the commonest reasons why miscarriage happens we can understand are related to the embryo, the uterus and then the patient's body. In the embryo, we know that embryo is formed from the egg and the sperm. So definitely when we are talking about genetic abnormalities in the embryo, they can come either from the sperm or from the egg and also sometimes from the parents in the form of genetic disorders. So as far as the embryo goes, 3 tests are very important. First test is karyotype or chromosomal makeup of both the parents to look for any balanced translocations which when transmitted to the embryo become unbalanced and cause a miscarriage. Test number 2 regarding the embryo is anti-Mullerian hormone or AMH, which tells us about the ovarian age and also how many eggs are remaining behind in the ovary. Now, why this test is important? Because we all know that women are born with fixed number of eggs. The third important test from the embryo point of view is the sperm DNA fragmentation index, which tells us that how many sperms are DNA fragmented. It's not difficult to understand that the egg DNA and the sperm DNA together make the embryo DNA. So, of course, if there are issues with the sperm DNA fragmentation, that can result in abnormal embryos resulting in miscarriage. If there is a problem in the AMH, like if the AMH falls in the decreased ovarian reserve range, that is between 0.5 to 1.26 nanograms per ml, again the eggs have more chromosomal errors and this can result in a miscarriage. So, let me tell you the example of a patient who visited me around 4 to 5 years back. She was only 29 years old and she came to me with 2 recurrent miscarriages. She had all the tests done, like the uterus was normal, she didn't have any infection, no medical disorders, and nobody was exactly able to find out what's going wrong. So, I did for her the basic profile including the karyotype, the sperm DNA fragmentation index for the husband and her AMH test. The husband's test was normal, karyotype also came back normal, however her AMH came to be 0.9, that is 0.9 nanogram per ml. Now she is actually only 29 years old and she had accelerated aging and this was the reason most probably she was having the miscarriages. So I immediately started her with adjuvants, supplements and medicines to improve the egg quality and we enrolled her into our IVF ICSI PGTA program where I stimulated her. I retrieved 11 eggs. We put the sperm inside the eggs, that is ICSI, and she had 6 embryos which reached the blastocyst stage. But to our surprise, we found that out of the 6 embryos, only 1 embryo was genetically euploid or normal and the remaining 5 embryos were abnormal. When we transferred this genetically normal embryo inside her, she got pregnant and she also had a successful pregnancy. Delivery was done by me only and we had a beautiful baby girl which was born. So AMH test helped her reduce the risk of her miscarriage and achieve a healthy pregnancy. Now, coming to the second important factor, and that is the uterus, the uterine environment. Uterus endometrium is the soil for the seed, that is the embryo. So definitely if there are problems inside the uterus, that also could be the reason for the miscarriage. It's just like the chicken or the egg. Like for example, if a patient comes to me with 2 miscarriages, there is a possibility that the miscarriages could have caused adhesions or problems inside the uterus, or maybe the uterus by itself had a flaw, congenital like a septum or something, which caused the miscarriages. So the best way to find out is to do a hysteroscopy for the patient, which is an endoscopic examination of the inner part of the uterus to see and treat any problems. Like for example, I post the patients for a diagnostic hysteroscopy and of course before that I do a mid-cycle ultrasound to check the uterine lining. Generally, most of these patients, we see a beautiful triple line endometrium and do not have any obvious things seen in the ultrasound. And that's why actually this factor goes unnoticed. When I put the hysteroscope, we try to look for adhesions, synechia inside the uterine cavity, and the commonest other thing which I see is a uterine septum or an arcuate uterus. Now, what happens is that the septum actually is avascular, and that's the reason if the embryo falls on the septum, it doesn't implant or it can get miscarried. There is a simple solution to this, which is adhesiolysis, synecholysis and septum resection, which can be easily done by a very small tiny instrument called as the hysteroscopic scissors. Some people use cautery or energy to remove the adhesions or the septum, but I am not really fond of that, because any kind of energy, if we are using inside the uterus, it can burn the lining, creating a bald patch. So I prefer to do the adhesiolysis or the septum resection only with scissors. Plus, I also take endometrial samples and send the lining for examination under the microscope to rule out any hyperplasia or any infection in the lining, which also could be the reason for the miscarriages. The third important part is the patient's body. When we talk about the patient's body, it means that we are talking about her immune system, the inflammation inside her body, and something what we call as thrombophilia or thick blood. There are a few syndromes which are called as APLA syndrome or anti-phospholipid antibody syndrome, which basically cause the blood of the woman to be thick, and this reduces the blood circulation inside the uterus and doesn't give enough blood to the baby, causing a miscarriage. These tests can be checked by a simple blood test, which can tell us whether the blood is thick or not. Also, in the recent times, especially post the COVID era, post-COVID vaccination, I have also seen that patients are having very high inflammation inside their bodies. Maybe it's because of the environmental toxins. And also we are seeing immune-related causes related to natural killer cells and cytokines. Again, we can do a simple blood test to look at these ratios, and we have treatment for that. So, the third system problem is also very important and should be investigated. So, the commonest tests which we do for this are, one is the thrombophilia profile, which is a blood test. Second is immune system tests such as a cytokine profile and natural killer cells. And the third test is basically for inflammation, that is total oxidative stress. These tests also give us an idea about the situation inside the patient's body and how much the toxins have affected the body, and we can give accordingly the medicines for the detoxification. Now I'm just going to give you a small word about the immune factors, because what I feel is that post-COVID and especially after the COVID vaccine, many people are having high immunity, and I'm finding high immunity as a reason for rejection of the embryo and also miscarriages. So recently I had a patient who is young, 29 years old, who had beautiful embryos, and she had before naturally 4 biochemical pregnancies and 1 miscarriage, and then she miscarried very mysteriously after the IVF. So she got pregnant, and then she had, like, at 6 weeks this massive bleeding, and the whole pregnancy just came out. So since we didn't find any particular reason for this, I decided to test her for the natural killer cells, the cytokine profile and the total oxidative stress, which came deranged for her. So we put her on an anti-inflammatory diet. We gave her antioxidants, omega, vitamin C for high doses for 1 month, and then after that we did her embryo transfer with immunomodulation. Immunomodulation is certain medicines and IV which we give to kind of lower your immunity so that you accept the embryo, and then once you're pregnant we continue these medications and injections till you are 10 weeks pregnant so that you don't reject the pregnancy. And luckily for her, she's already 8 weeks pregnant now. It's a difficult thing to say that whether it is these medicines which helped her, or maybe she would have just had a healthy pregnancy even without them. But I personally feel that these medicines do have a role in selected cases. So, it's very important for us to understand that miscarriages are not normal, and with each passing miscarriage, your uterus becomes weaker and weaker. So, please do not suffer in silence. If you're having recurrent miscarriages, consult a doctor and find out what's the reason, and do not miss on any of the tests. Do not keep doing the redundant old-fashioned tests, because nowadays the miscarriage profile includes different types of tests which I just mentioned throughout this whole video series. Please do them and make sure that you don't try to get pregnant till you have the answer, so that whenever you try next, you have a healthy pregnancy. Good luck. Regarding the uterine factor, I would like to state the example of a patient who again came to me with multiple IVF failures and one miscarriage. I had decided to take her for IVF, but the patient was not so keen since she had already spent a lot of money. So, I decided to check her systematically, like my profile, and I found that her AMH level is 3.5 nanogram per ml. Husband's sperm test was absolutely normal. The DNA fragmentation index was normal. Karyotype of husband and wife also was normal. Then I checked her uterus. The uterine lining looked okay. However, the character of the lining was not very nice, and it looked like there were some cystic spaces inside the lining. So I told the patient that since your AMH and the sperm test and karyotype is good, most probably you don't have genetic abnormalities in the embryo, but maybe the uterus might be the reason. So I went inside her, I did a hysteroscopy, and I found that there was a very deep septum covering almost one-third to two-thirds of the cavity. And I did the septum resection for her in 2 sittings. In fact, it was such a big septum that I had to cut it in 2 sittings. And after the septum resection, I just told the patient, okay, now that we've cut the septum, and since you're not so keen on IVF, I just give you some detox medicines, multivitamins, coenzyme Q10, antioxidants, and you can just try naturally. And this patient got pregnant naturally, and she delivered again a beautiful baby girl in Emirates Hospital with me. So you see, like for her, the IVF failures and the miscarriage was all related to the uterine factor. Many patients ask me that are the torch infections tests important as far as the recurrent pregnancy losses are concerned. So what I tell the patients is that torch tests are not important for recurrent pregnancy losses, because all the torch infections, maybe they can cause one miscarriage. However, whenever you have that infection and say it causes your first miscarriage, you get immune to these infections. Like the primary infection will give you immunity. It's just like chicken pox. So once you get the immunity, it cannot cause the second miscarriage. That's why torch infection test is not relevant in a scenario where there are more than one miscarriages.